Good day friends, I am Dr. A.S.K. Gupta. I am going to talk to you about cervical lymphadenopathy in a young patient around 47 years of age who has a discharging sinus in the neck, and she is suffering from this problem for last 2 years. She complains that she has one lymph node, there is a discharging sinus, it ruptures and heals, and another lymph node comes within a few weeks, and she is not able to get relief, and she has got many tests done and the tests for the tuberculosis are negative. Here you can see that there are two lymph nodes in the neck, and these lymph nodes are communicating with each other, and they are called as the matted lymph nodes. When the lymph nodes they caseate inside, they form a cavity, and the cavity reaches the surface, and both the lymph nodes or the surrounding lymph nodes join each other. They are called as the matted lymph node, and it is characteristic of tuberculosis. Nodes, we find that there are multiple lymph nodes one after the other. All the lymph nodes may not be caseating, but there are multiple lymph nodes with a hyperechoic center. The whole cervical upper group is having multiple lymph nodes. These days the caseation is not very common because the patients they come early and they get treated soon, but because she has come to us after nearly 2 years of disease, many of the lymph nodes have got caseation and cavity formation, and in an endemic region like India, the first diagnosis has to be tuberculosis. And here you can see that this is a discharging sinus, and the pus has discharged from this, and there is a hypoechoic center in this lymph node, and this is seen on the skin also. These various sizes of the lymph nodes varying from 0.5 centimeters to 1.5 centimeters to 2.5 centimeters to 3 centimeters. They are significant in size as well as the fluctuation. Here you can see that this is a discharging sinus, and there is a pus over here, and this is communicating with the rest of the tissue. Now I come to the right hand side on the lower cervical chain, and I find that there are multiple lymph nodes here also, and here we find two lymph nodes which show the central cavitation. Here you can see that there is central cavity, and here you can see that the central part of the lymph node appears to be having a cavity because the central part of the lymph node has got caseation, and this is characteristic of tuberculosis. Another important thing about this patient is that she got a PCR done or the gene expert done from the government lab, and the PCR or the gene expert was found to be non-confirming for the tuberculosis. Why is it so? Because the lymph node tuberculosis is a paucibacillary tuberculosis. It means that the mycobacteria are very little in the cervical lymph node tuberculosis, so they might not be picked up even on the PCR, and the clinical diagnosis, the clinical features, the symptomatology of the patient, and the endemicity of the tuberculosis in this region of India is likely to make this diagnosis as the tuberculosis first diagnosis, and she should be treated accordingly. I hope you like this video. In case you like it, please do subscribe to our channel. Do not forget to press the like button and share the video among large number of friends so that maximum number of people can be benefited. Thank you very much.